Our next speaker is Dr. Noha Hakel. She is a trainee, pediatric trainee gastroenterology, grades at King's College, London, UK. Noha also is a former clinical fellow, senior clinical fellow of nutrition and spinal failure at Great Ormond Street Hospital. She's having lots of experience in training applications and also great. So she will speak about a great subspecialist career, starting from how to prepare for subspecialist career, how to apply for grades, and also how the grade training looks like. So, Noah, thank you so much for joining us today, and over to you.
Thank you so much. Can you hear me and can you see my slides?
Yeah.
Is it moving? Oh, just a second. Not sure why it's not moving. Can you see it now? No? Share. Moving?
I think we're just waiting for the, I think it's moving, Dr.
Okay. Okay, so thanks, Bipan, and thanks for the organizers to invite me to this meeting. I'm Noha Hakel, and I'm ST7 Pediatric Gastroenterology grid trainee currently at King's College Hospital at London. And today, my talk will be about the pediatric subspecialty training, or what was previously known as grid training. So this will be our objectives today. I'm going to talk, to be fair, I didn't know who is the audience for this meeting, so I didn't know where to start for trainees or for someone who never worked in peds in the UK. So I thought first to give an idea about the GRID, or the pediatric subspecialty training. What are the available pediatric subspecialty programs offered by RSPCH? Who can apply and when can they apply? The application process, which is very similar, by the way, to ST3 applications. So thanks for Dr. Ammar. I think he explained a lot of it. And then the most important, how to build your GRID application. So we will spend more time in this point. And then what are the available resources for everyone to go through the requirements. So first, the GRID, or the new name as Pediatric Subspecialty Training Program. It's a recognized training program for pediatric subspecialties, starting after completing the core pediatric training, which is ST1 to ST4 in the new Progress Plus. And usually it lasts for 2 to 3 years, according to specialty. So there are some specialties that are only 2 years. And once you finish this training, you will be awarded dual CCT. So your CCT will be in both general pediatrics and the subspecialty you are trained in. So, theoretically, you can apply for both general pediatric consultant posts and subspecialty consultant posts if you want to. It's different from SPIN, which is special interest, and this is beyond the scope of this presentation, so I'll focus more about the GRID. And overall, it's worth thinking about this early in your career, as it takes time to explore options, prepare applications, and build your applications. So if you are a fresh graduate or a fresh trainee in the UK, you might start thinking about this actually in ST2 and could be earlier. You can start by asking yourself whether you want to do general peds or not, and what are the pediatric subspecialties you are interested at. If you are an IMG, or if you have worked in the UK before, like in a fellow post, and you already know what's your subspecialty and where you're interested in, that's a different position. But however, you need still to start preparing for your application as early as possible. The RSPCH offers 17 pediatric subspecialty programs, and it covers the most famous or well-known pediatric subspecialty. Could be child mental health, community child health. I've listed all of it here. You can go through it. However, just of note that the pediatric gastroenterology, hepatology, and nutrition, it is still one subspecialty, and whoever is trained in gastro or hepatology will be on the specialist register of PGAN, which is pediatric gastroenterology and hepatology. How you can say that it's almost 18 programs. Important to know that the RCPCH does not offer training in the specialties below. Some of it is quite expected, like audiology, dermatology, psychiatry, anesthesia, but some of it could be a well-known pediatric subspecialties. Maybe some of you would have worked in it outside the UK. So for example, there's no pathway by the RCPCH for the pediatric hematology. So you need to contact the Royal College of Pathologists. The same for the pediatric cardiology, you need to contact the RCP, the Royal College of Physicians, and the entry points and the application process and the interview is completely different. So you need to call them. And also the pediatric clinical genetics, which again is following the Royal College of Physicians. And actually, I would advise to try to explore all the subspecialties. If you are a fresh graduate or if you haven't made your mind about certain subspecialty, because choosing subspecialty, it's not only about interest, it's about interest, about lifestyle, about work-life balance, about available posts. So there are many factors actually that can affect your decision about subspecialty. And also the available consultant posts. So I wanted to put all the 17 programs because if you check the available posts every year. So for example, something like pediatric metabolic medicine, I don't think they have offered a grid post this year. So it could be also a disadvantage. I mean, something like pediatric gastroenterology or of course community or neonatal medicine, they have to post every year, but other more rare specialties, maybe like allergy or rheumatology, not necessarily every year. So this is something you have to put in your mind before applying. Who can apply and when? So any RCPCH trainee, RCPCH academic trainees, or Republic of Ireland pediatric trainees, which means that you cannot apply to subspecialty training if you are not in training or carrying an NTN, which is National Training Number. And at the moment, there is no entry point directly for the subspecialty training. So for the pediatric training, there are 2 entry points, usually at ST1 and at the moment at ST3. Maybe 2 or 3 years ago, there was a rumor that they were going to create a new entry point at the level of ST5 to the pediatric subspecialty. However, there is no confirmation about this. And my personal opinion, I doubt that this will happen, especially in the changes now in the application process and the prioritization of the UK graduates. So if you want to get to the grid, you need to get to the pediatric training first. So if you are a pediatric trainee carrying a training number, you need to complete all of your MRCPCH examination at the point of interview, and that includes the clinical exam as well. And you should not be waiting for the results. So if your results are not announced yet, you cannot have the interview. That's one thing. The other thing is you need to complete your core level pediatric training by the time of entry to subspecialty. So for example, if you apply at ST4 and then you get a post and then you will start it at ST5, you need to be signed off for all the core training before. If you're not signed off for any reason, that can delay your joining to the grid training. And then you have to have an ARCP of outcome 1 at the point of application. The quite interesting part here that they have not specified exactly when can you apply. Okay, so there is no rule against applying in ST3. However, practically, you cannot really apply at ST3 because if you are a fresh trainee and you're just at ST3, most probably you don't have the enough exposure to the subspecialty that will allow you to apply to grid application. And if you are an IMG with extensive experience in subspecialty and you've joined, for example, from ST3, you still need ARCP outcome 1 when you apply to the grid. So practically, the first point you can apply to the grid application at the beginning of ST4. And then the most important point is you must have enough time to complete the subspecialty training before the CCT date. So that depends on your program, whether it's 2 or 3 years. So you need to make sure that you still have time in training. So for example, if you have 1 year left, then you cannot apply for a grid application. And this is a very important point because there are no limits of how many times you can apply to grid. Again, like 3 or 4 years ago, it was limited only to 2 attempts, but now you can apply as many times as you want to the grid, provided that you have enough time. Who can apply? Sorry, I've put this slide because I wanted you to know what is CSAC. The CSAC is a College Specialty Advisory Committee. They are the ones shaping the training of the subspecialty. They are the one reviewing the applications. They are the one doing the interview, and everything related to you as a grade trainee will go to your named CSAC. Okay, so it's a group of consultants, usually 6 or 7 consultants in the subspecialty, and responsible for everything related to subspecialty. So when we say CSAC in the next slides, I just want you to be familiar. And of course, each specialty has its own CSAC. And if you go to the RSPCH website and just type CSAC, you will have a link for each CSAC, including their names, their contacts, and what is the role exactly. Going back to how many times you can apply. So as we said, we are not limited to the number of attempts you can apply, but you need to have enough time remaining. So I'll give you an example. If you applied at the beginning of ST4 and you are applying to a 3-year training program and you were lucky and got the grid post from the first time, then you will have ST5, 6, 7 remaining to finish your training, okay? But what if you don't get it? If you continue ST5 and you are a full-time trainee, then most probably you will need to apply again at the beginning of ST5. By the time you get into the grid training, you will be ST6. So most probably you won't have enough time to finish the 3 years program. So at this stage, you might take an out of program, pause your training, go out of the training, try to apply while you are out of program, and then depends on whether you get it or not, and then go back to the program. So this is an important point that you in the Progress Plus training is not a subspecialty friendly. This is very important. This is the main way. And this is one of the disadvantages actually of the Progress Plus. It's not subspecialty friendly, but they encourage everyone who wants to apply for more than one time to the grid just to have an out of program and pause their training. How many subspecialties you can apply for? You can apply for 2 subspecialties in each round, but you need the separate application forms must be submitted for each subspecialty. And I have to say, I had a friend who applied to pediatric endocrinology and pediatric gastroenterology in the same round, and luckily he got posts in both specialties. I don't think this will be very possible now because they have changed the application process a little bit, but it happened before. And again, the indicative training time, if you are toward the end of your training, you need to read more about the indicative training time. You need to email the CSAC, okay? Because they can accept actually 1 year of fellowship out of program that's related to the subspecialty, but only 1 year, okay? And you need to inform the CSAC in advance. So you cannot just take out of program and let's say do a fellowship about in pediatric gastroenterology, for example, and then you join the training again and ask them to count this in your grid training time. Again, 3 or 4 years ago, this was accepted, but now you have to email the CSAC in advance about your plan. And actually, this is a very valid point. When you apply to fellowship posts outside the training, you can, instead of waiting for posts to be advertised, you can email the lead consultant in the required specialty you want to work in the tertiary hospital, closest tertiary hospital to you, and explain your situation. I'm a pediatric trainee. I want to apply to grid training, but I need more experience in this subspecialty. I'm happy to take an out of program time and maybe do a fellowship with your team. Do you have any available posts? And personally, I've seen that there's preference for the departments to give posts for pediatric trainees preparing for the grid. So this is, you will gain 2 benefits from this. First, that you will be exposed to the subspecialty, so you will be able to build your application during the time you spend in this subspecialty. And second, that will pause your training and gives you more time and more attempts to apply for subspecialty. The application process. So this is a new Progress Plus. I mean, there's the core pediatrics, and then at the ST4, you have 1 or 2 pathways. So either to continue in the specialty pediatrics or general peds, or you go through to the grid. And usually they say it's 20% of the pediatric trainees will go through the grid pathway. Again, there's a SPIN, which is special interest. I mean, I'm not going to talk about SPIN in this presentation. I think it's better for a SPIN trainee to explain it, but again, it's also an option for someone who might be interested in the subspecialty, but yet he cannot apply to the grid.
The recording has stopped.
And maybe applied, didn't get it, or he might have some family circumstances not allowing him to.
This meeting is being recorded.
For the grid, so it's a good option, but it's beyond this presentation. The application process, okay? The application process is exactly the same as the one as ST3, I mean, logistic-wise. So I'm not going through it again. I think Dr. Ammar has covered this very well. It's through the ORIAL. There's a timeline, there's a long listing process, and a short listing process, and an interview. You can find the timeline on the RSPCH website. However, what is different in grid application you need to do? First, you need to have a discussion with your ES, and it has to be an early discussion because your ES can guide you in building your application. Your ES will need to sign a form that you are ready to apply for the subspecialty, and then forward it to the TPD. So you need the ES approval. So I always advise to start this as early as possible because you can never know the obstacles you can face. Simply the ES can refuse for any reason. You need to go to the college tutor, you can escalate it a little bit. So you need to put time for this. And then the different part here, we need to submit a confirmation of eligibility form to demonstrate your eligibility to apply to subspecialty training. So this form will be on the Kaizen, needs to be signed by your ES, and then to be forwarded to your TPD, the training program director, and then the TPD has to approve it in order for your application to be accepted. So first, this needs time, and then there's a timeline for acceptance of confirmation of eligibility form. It differs between each deanery. So London deanery is different from East of England, for example. So this will be on the RSPCH website. You can email your TPD, but it won't be accepted after the deadline. They have changed a little bit. So again, 2 or 3 years ago, things are getting more competitive. A lot of changes happened. So 2 or 3 years ago, the confirmation of eligibility form, if you check it, you will find just 2 or 3 questions. Do you think this trainee is ready to apply? Do you think this trainee will finish core training at expected time? And then your supervisor has to say yes, yes, and forward to the TPD. However, they have made some changes to try to filter a little bit the applicants because there are a lot of applications and the competition ratios has gone up. So now you are required to include 3 examples of clinical activities or experience to put it in your confirmation of eligibility form, which means that, again, this is what I was talking about. It needs a prior planning. So when you can't just start thinking about the application, grid application, when you were filling the confirmation of eligibility form, you need to think about this in advance. What are the clinical examples I'm going to put? You need also to describe your most significant quality improvement, and it doesn't need to be related to the subspecialty, but it needs to be a good audit. And then you need to link this to evidence from your e-portfolio. It could be CBD, could be reflection, could be an audit, whatever. And this needs to be verified by your education supervisor. So you have to build this in advance, and you have to discuss it with your supervisor. And to make things a little bit more complicated, now they insist that the scenarios you include in this form to be the same scenarios you will use in the application in the clinical skills domain. We'll go through this in a few minutes. So again, don't forget, this is a timely process. It takes a lot of time and you never know what you will face. Start it as early as possible. How to build your application. So good news is that the application is required only for shortlisting. So it does not change or affect the final score after shortlisting. So there's a separate score for the application and separate score for the interview. So the only aim of the application is to get you an interview. So once you finish the application and get an interview, congratulations, forget everything about the application. There is a document by the RSPCH called Shortlisting Scoring Criteria, and this is the most important document. If you are ST2 or ST1, start reading this document now, okay? Because there are a lot of things needs to be done and needs to be arranged in advance. I've put a link here. This is the most recent one. And it's similar somehow to the ST3 application. So you can see that it will assess 6 domains. It could be, that will be clinical experience, leadership and management, QI and audit, education, involvement in teaching, research experience, and finally, it will be publications, presentations, and posters. So just give me a second. I need to go back to the, yes. Okay, so as we said, these are the scoring domains for the application. And I'll just give you an example about the scoring. I mean, it depends on what you have done. They will give you a score. So it's not easy, but it could be, you can calculate the expected score you will get from the application roughly. That's one thing. And the other thing is, the most important about this, that it will show you a roadmap, or it will create a roadmap to you what to do in the next 1 or 2 years to build my application for great application. So for example, for leadership, what my advice is to grab a paper, divide it into 6 sections, and write each domain in each section, and then state what you have done so far, and compare it to the scoring criteria. Let's say I've done only leadership at local level, that will give me 1. So I need to work on how to improve my score in this domain. So I need more leadership, for example, at national or international level. So I need to do this. So it will help you to create a PDP to what to do in the next 1.5 or 2 years. I'm not going through the scoring criteria in details, but I'll give you some tips and tricks how to cover the application. At the end of the application shortlisting scoring criteria, there is a shortlisting scoring criteria glossary, which means that it will explain in details each word that they have mentioned in the scoring criteria. So I'll go back to this. I'll show you how. So if you go down here, this is the most important actually. So for example, let's go to the publications, because it's a bit confusing, okay? So it will tell you what will be counted as national, what can be counted as international, whether letters will be counted or not, whether posters will be counted or not. And also, for example, in the research, it will explain exactly how it will be scored. So that again will help you to.
Excuse me, sorry. We just can see shortlisting scoring criteria. Are you sharing something different?
Oh yeah. Okay. Sorry. Sorry, just give me a second. Share. Can you see it now? I'm moving the scoring criteria. No?
Yes. Yeah.
Okay, good. So I was talking a bit more. This is the scoring criteria. The most important part actually is the Annex A, that's a shortlisting scoring criteria glossary. It will explain to you what to fill in each domain and how can your, whatever you have done, how can it be scored, okay? So this is very important because you don't know what's local level means, regional level means, national level means. Also, there are some confusing aspects maybe about quality improvement, whether you have designed it, what does it mean to lead a quality improvement? Because as a trainee, you're not expected to lead a quality improvement all by yourself. So they will explain to you that leading a quality improvement can be under the supervision of a senior trainee or a senior consultant. So this is very important, and also it explains a lot of the scoring criteria. I'll have to stop share this and go back to my presentation. Sorry. Apologies, I'm not very good in technology, so I will go back to the presentation. Yes. Can you see it now? My presentation.
Yeah, we can see it.
Okay. So tips and tricks, okay? I mean, it's very similar to the ST3 applications, but there are certain tips and tricks because people have high expectations of the grid application, but actually it can be very simple, but you have to be target focused. So you have to know what are you looking for, what I want to do, and do it in a very simple way. It doesn't need necessarily to be complicated. And they are not expecting you to be an expert in the subspecialty you are applying for. So for example, in pediatric gastroenterology, I get a lot of questions about endoscopy and exposure to procedures, but actually this is not required at all in the application or even in the interview. I mean, if you have attended one just to get an idea about this aspect of the specialty, then that's great, but you're not required to actually do an endoscopy before the application. So sometimes people put extra burden on themselves by not knowing what to do and in a smart way. I have always a principle in this. You need to work smart, not to work more. Okay. So tips and tricks. Okay. First, you need to spend time within the UK and the required subspecialty in order to build your CV. Even if you came if you are an IMG with an extensive experience in the subspecialty, that can be extremely good for the application. However, I would, because the competition now is higher, I would advise always to get evidence within the UK. That will give more weight to your application. So how to achieve this? Well, it depends, okay? If you are in training and you are ST2 or ST3, you can email your TPD asking for a 6-month rotation in the required subspecialty, okay? That could be more than enough to get the clinical exposure, to get the idea to work on some projects or audits, or simply to be involved within the community or the society, networking. That's very important. Sorry, excuse me. However, outside London, I think it might be sometimes difficult because you might have only one tertiary center within your deanery, or maybe 2 tertiary centers. So it could be one department of the subspecialty. So there can be a lot of applications, or maybe senior trainees doing SPEN. So sometimes you cannot get this. I would advise to do to ask for an out of program and look for fellowship posts in the closest tertiary hospital to your deanery. And actually, this is advice on the RCPCH because they acknowledge that it's not subspecialty friendly, and they advise actually people to take out of program. And I remember, although I had a lot of experience in gastro outside the UK and even inside the UK, even my TPD advised me to have to take an out of program. And then I explained to her, well, I've done this already before joining the training, so there's no need for it. So if you are planning to apply at ST4 without previous experience and working in the UK, most probably this will be the first advice given to you. Try to go out of program. So again, as I said, it's not subspecialty friendly. How to build your CV. So starting, just few tips and tricks, okay? Clinical experience and exploration of subspecialty. What are they looking for here? They're looking more of transferable skills, okay? So I assure you, if you spend 3 months or 6 months in the subspecialty, you should cover this domain, okay? But it's about choosing the right examples. So you need, when you write the application, they will ask you for 3 examples for clinical experience. Each example is 50 word. So the word count is very limited, so you have to be smart and you have to show 1 or 2 transferable skill in each example you choose. So the transferable skills, first they look for clinical skills like inpatient management or A&E management with escalation to seniors. So you can mention an example of a complicated patient that you have managed, of course, under supervision as inpatient, or someone you have seen in the A&E and maybe discussed with a tertiary center if you didn't get the chance to work in a tertiary center. They look for communication. So I would suggest as a second example, you would mention maybe difficult family or difficult patient and how you dealt with the situation. And again, they are not expecting you to deal with it completely independently, but at least as a senior SHO or as a trainee, you are usually the first contact point in these situations. Teamwork and collaboration. So this is a transferable skill, how to work in a team. You can definitely mention in your application. So you can mention MDT examples, whether that within the inpatient service or maybe a post-clinic meetings where you discuss a patient scene in clinics, or MDT with other specialties, could be gastro and surgery, gastro and histopathology. Of course, I'm a gastro trainee, so I'm giving a lot of examples related to gastro, but I'm quite sure there are a lot of MDTs in different specialties. Leadership. So when you can mention an example to discuss with tertiary center when to refer, and if you have finished the discharge yourself, if given handover, so safe discharge. And actually, as I said, if you spend 6 months or 3 months in subspecialty, for sure, I'm quite sure you will cover this. And I have helped many trainees in their applications, and I was quite surprised that many people would say, oh, I don't have enough experience in this. But then when we go through their CV, I find a lot of examples they can use. So you have to brainstorm your, do a bit of brainstorming and think about complicated patients or MDTs. I'm quite sure you will find something. It's quite easy to get it, but it's important to know what to put, because again, I've seen many applications and people just keep using examples that reflect only one transferable skill. So you have to be wise in what to write. Leadership and management, again, they have explained very well what's meant by leadership within local level, within regional level, within national level, how to get leadership. So first, you can be junior doctor trainee rep in your hospital and deanery, and that's not difficult at all. You can join the trainee committee in RSPCH, for us, London School of Pediatrics, or whatever your local deanery. And I'm quite sure this is possible for everyone, because I get emails from the RSPCH. If you want to join the trainees committee, from the London School of Pediatrics, if you're interested in joining the trainees committee. So this is something definitely you can look for. You can join the trainees committee or the working groups in the national society. So each specialty would have a national society. So for example, we have the BUSPIGAN in gastro. There is one for the endocrine, can't remember the abbreviation. There's also the allergy. I'm quite familiar with it because of the GI allergy. So look for the national society and try to join it as a trainee rep. So first there's trainees committee, and they accept trainees from outside the grid training. And there are working groups, for example, the education group or teaching group or research group. You can join it as trainee rep in these groups. And definitely they do not need to be trainee, and they do not need to be in the grid training. So I've known some colleagues who were preparing for Caesar application in subspecialty, and they have joined as trainee rep in working groups to cover the leadership part. You can also arrange regional study days. So you can contact the Royal Society of Medicine asking for any opportunities in organizing this. And this will be under leadership, not under teaching, if you just organized the teaching, not presented. And also, as IMGs, there's soft landing. I would advise maybe you can get involved with soft landing or get involved with the BPAN now. You can get also more of leadership opportunities. Tips and tricks for QI audit. Again, they have explained it in details, so I don't need to go through this. But it's important to know it's not necessarily in the specialty. They said it's not, obligatory to be a full audit, but what they meant is it's not obligatory to be re-audited by yourself, okay? Because they understand that most probably you spend 6 months in the rotation, so most probably you won't have time to re-audit, but at least someone could have re-audited this. And the most important is to implement a change after the auditing. So this change can be creating a new clinic, creating a new MDT, improving service. I've put here an example, and it doesn't need to be something very difficult. It could be something to assess the patient satisfaction, something that, or maybe creating a QR code for some educational materials for patients. So it doesn't need to be something complicated. It can be very simple, but to the point. And you can present your audit in a national meeting, and RSPCH accept these type of audits. This began, they encourage the new trainees, and I've seen a lot of ST1, ST2 getting oral presentations, and this began to encourage them to apply for posters or presentations in national meetings. Education involvement of teaching, again, there's formal degree. This is something either you have it or not. If you want to go out of program to get it, that's fine. There's also the regional teaching. As I said, you can email the RSM, express your desire to participate. And again, if you are ST1 or ST2, you can give a presentation about the well-being or the challenges faced by you as a trainee. Doesn't need to be a complicated clinical thing. Of course, present teaching, journal clubs, and there's bedsides, there's SIM as well, there's medical student study groups, but just be aware what could be counted as regional or what can be counted as national. Research, again, some people are quite lucky to have like postgraduate degrees or they've done research already, so they should be covered from this aspect. However, if you are not, maybe you can think about retrospective studies. That's easy to be designed. Data can be collected easily. Clinical coding will be your best friend. You can create a database and present it in one of the national meetings. You can get involved in one of the ongoing studies in your department, or you can suggest it. And as I said, it can be very simple, something like demographics or ethnicity of patients with celiac disease. So celiac disease was known to be a very European disease, but now we started to see a lot of patients with African descent and African background. So why not to look into the ethnicity and how this has changed and why it has changed as well. So again, it can be simple. Sorry, maybe I've done this. Publications, you have, doesn't need to be high impact journal. It can be within the BMG, Archives of Childhood Disease, which is ours, and it can be an article about the trainees' life, challenging faced by the trainees or the well-being. So it doesn't need to be something complicated, and it doesn't need necessarily to be related to subspecialty. They are not expecting you to be a consultant in your subspecialty. Hopefully, I'm in the last slide. The most important is, guys, is networking. You want to know the tips and tricks in each specialty unless you speak to someone who's inside. So you need to attend the trainees meeting of your chosen subspecialty. You need to speak to the trainees. You will meet the CSAC there, and you can express your desire to join your the subspecialty. There's usually a WhatsApp group of the trainees among the UK. Join it and see what they are doing, what are the activities. Attend the National Society meeting. So you have like BusBegan or whatever the subspecialty you're choosing. There are some social meetings organized by the trainees. Try to get involved in these meetings and talk to the trainees to explore what can be offered to you. Don't be afraid to email the CSAC and ask for advice. They're all very helpful, and they want to get enthusiastic people into the subspecialty. And finally, look for a mentor. These are the available resources. So you will find a pediatric subspecialty training application guidance. You have to go through it. There are a lot of downloads that you can read as well. And there is a pediatric subspecialty careers event organized by the RSVCH. And usually it happens in July every year. And that's it. Thank you.
Thank you, Dr. Noha. We just have a few comments and questions on the chat. So I think the first question that was about leaving the slides because some people have to leave. Yeah, we're uploading that anyway to the website and to the Facebook later on, LinkedIn, and also YouTube. The other question for applicants for grid subspecialty: do we have to apply through Track Job or by NHS Job website?
No, it's through Oriel. So it's logistic-wise, it's exactly the same as ST3 rules apply. You need to prepare it in advance. It has an opening window. You need to catch it and try to submit it 48 hours before the deadline.
Okay, and there is another question as well. If someone, you might have answered that already, if someone is only a part of an audit, like data collection, but not complete audit, will the application can be accepted?
It will definitely be accepted, but the question is how they will score it. So if it's the only thing you have, then that's fine. But if you have time to improve it, or maybe present it yourself if as a first author, then I would advise this is better, but it will definitely be accepted.
Yeah, the other question regarding fellowship, is it equal to grid? And is it okay to apply if not in training?
I'm not sure what does it mean equal to grid, because the grid is only the formal pathway to get subspecialty training. However, there's also CSER in subspecialty, so fellowship can count toward this if you use it to document evidence. So yes, if you spend enough time in these fellowships, yes, you can get into the specialist register of subspecialty. What was the other part of the question?
No, that's the whole question. Yeah.
Oh, okay. Yeah.
Thank you.
Perfect. Thank you, Noha. Thank you so much. It was so informative. And as you're part of BPAN, so definitely we're going to grab you as a mentor at some point for our members. But thank you so much for your excellent presentation.